So we're also going to be talking today about kidney cancer to help educate you about this disease so that you can share information with your family, your friends, your coworkers. Joining me today is Dr. Zach Klaassen. Dr. Klaassen is a urologic surgical oncologist at the Georgia Cancer Center. Dr. Klaassen, thank you for joining me today.
Pleasure, Chris.
As I mentioned, March is Kidney Cancer Awareness Month. I see you have your
Yes.
ribbon on.
Proudly wearing my ribbon for March.
So, Dr. Klaassen, how common is kidney cancer?
So kidney cancer is the 6th most common cause of cancer in men and the 8th most common in women. And that estimates from the most recent cancer statistics that come out every January suggest about 74,000 new cases in the U.S. into 2020 and about 14,000 mortalities. So it's not the most common, such as breast, colorectal, prostate, but it certainly is in the top 10 for both genders.
Now, I know there is not a traditional screening method for kidney cancer like mammograms for breast cancer,
Right.
colonoscopies for colorectal cancer,
Right.
but there is kind of a common way kidney cancer is detected. It's through incidental screening. Talk about how that happens, what that is.
Yeah, so incidental screening means that it's picked up when you're looking for something else. So for instance, let's say somebody comes to the emergency room, let's say they have a GI bug, so they do an ultrasound of their abdomen and they find there's something on the kidney, looks a little bit suspicious, so then that's followed up with a CT scan. So the kidney cancer, the kidney mass was diagnosed when you're looking for something else. And so we find a lot of the small renal masses anything less than 4 centimeters, a lot of those are picked up incidentally. So you're right, there is no exact screening tool for it, but we see in about 15% of patients, usually the more locally advanced ones, patients will have flank pain, almost like a kidney stone. They may have blood in their urine, and so those are two things that may suggest a more locally advanced. Not everybody that has those symptoms has advanced kidney cancers, but those are the ones that can present as well.
Okay. What treatment options are available for patients with kidney cancer?
So there's several treatments. It's very much what we call a surgical disease, which means if you do surgery on it and you're successful in removing either the whole kidney or part of the kidney, depending on how big the mass is, ideally that's all the treatment they need. So we would follow those patients with surveillance CT scans and ultrasounds after that. So it's a very surgical disease. It's very treatable in sort of the localized setting. Even some patients that have comorbidities, maybe they have a bad heart or they have diabetes, they have pulmonary problems. If they have a 1 to 2 centimeter mass, we may just do surveillance on that, which means that we'll follow it with a series of ultrasounds and CT scans, and we know that the risk of the tumor spreading outside the kidney less than 3 centimeters is pretty low. So in certain patients with comorbidities, we may watch that for a while. And so when we get into the more advanced disease, so either locally advanced surrounding structures or metastases to the lungs, the liver, the bone is most common, then we move into a whole different realm of treatment, which is called systemic therapy. So we've got a lot of exciting immunotherapies, a lot of which we're using here at the Cancer Center. One of my medical oncology partners, Dr. Curry, is involved in clinical trials with that, and he's at the front line of sort of the immunotherapy treatment for kidney cancer. And we've got some other sort of targeted therapies that we've used over the last decade or so. But really the immunotherapy in sort of the metastatic setting has really been a great game changer. It's pretty well tolerated, and we've seen some remarkable responses to that.
Okay. Talk about the psychological side effects associated with a kidney cancer diagnosis and the subsequent side effects of the treatment that you just talked about.
Yeah, so I know that one of my big clinical and research focuses is the mental health and sort of psychological aspect of cancer. And kidney cancer certainly hasn't had as much of, let's say, press as say prostate cancer, bladder cancer, but any cancer diagnosis can lead to psychological side effects and depression associated with that. So that certainly is the case for kidney cancer patients as well. Now, specific to their treatment, depending how big the surgery is, we may have to make a big incision down the midline, a big one on the side. And so there's post-op recovery from that. There's pain. There's all the sort of fatigue that goes along with the cancer surgery recovery as well. And in terms of when we get to the more of the advanced stuff, the side effects of the immunotherapy, fatigue, anemia, to name a few. So there certainly is specific side effects related to the treatments, but just generally the cancer diagnosis always is a big one for psychological aspects as well.
Okay. Thank you. So the the last question we have about kidney cancer, and then we have another question about the coronavirus.
Sure.
We'll finish kidney cancer
Yeah.
first. What can patients expect when they come to the cancer center and have a diagnosis of kidney cancer, maybe from their primary care physician?
Certainly. So what you can expect is, especially if it's a localized, so it's just in the kidney, you'll see myself or one of my two colleagues, Dr. Martha Terrace or Robbie Mahdi, we're the three people that are the surgeons that treat the kidney cancer. And so we'll go through we'll show you pictures of the mass so you can see exactly what we're talking about, because all of it's sort of theoretical, so you can sort of see what it looks like on an MRI or a CT scan. And then we'll talk about options. The options may be that we can do a surgery where we just take part of the kidney with the tumor and save the rest of the kidney. That's ideal, because 1.5 kidneys is better than one.
Yeah.
Certainly if it's a little bit bigger and it's safer just to remove the whole kidney, we'll discuss what that entails, whether it's through robotic approach, which is minimally invasive, or if it's big enough, we have to do sort of an old-fashioned big incision to get it out. So we'll go through a lot of options, and certainly, as I mentioned before, with the surveillance, we may just say, all right, this is a small mass, let's say it's 1.5 centimeters, we're gonna get an ultrasound in 6 months, and just sort of reassuring the patient that the risk of it spreading at that size is so low that we feel it's safe, that most people, if they want a period of surveillance, it's not unreasonable.
Okay. Now, Dr. Klaassen, thank you for joining me.